Hi, physiotherapy students, and welcome to your first ICU placement. In this online webinar, we will be providing information about using the Cough Assist machine. Here are some learning outcomes for today. Please pause this slide to read them. So the Cough Assist machine uses a high expiratory flow rate created by applying a positive pressure known as insufflation and then rapidly switching to a negative pressure known as exsufflation. Compared to other modes of assisted coughing, it actually produces a greater increase in peak cough flow. Coughing can be divided into 3 phases. During the inspiratory phase, inhalation occurs, which helps you produce the volume necessary to effectively cough. Closure of the larynx combined with contraction of the muscles of the chest wall, diaphragm, and abdominal wall, resulting in a quick rise in the intrathoracic pressure, occurs during the compression phase. The third phase is expiratory. This is when the glottis opens, resulting in high expiratory airflow, as well as the sound made when coughing. Here, large airway compression occurs. This high flow helps push mucus out of the airways. So the main population the Cough Assist machine is used for is patients with neuromuscular weakness and spinal cord injuries. For example, patients with neurological conditions such as Guillain-Barré syndrome often have weakness in their expiratory and inspiratory muscles. The strength of these muscles is associated with the effectiveness of the patient's cough, which leads to whether they are able to clear their secretions effectively. So indications for this device include any patient who is unable to clear secretions due to reduced peak expiratory flow, and as mentioned earlier, neuromuscular conditions with paralysis or weak respiratory muscles. Here are some contraindications and precautions to be aware of before using a Cough Assist machine with your patients. Please pause this slide to read them carefully. Other things to consider include combining treatment techniques to maximize sputum clearance, such as suctioning, positioning, and manually assisted coughing technique. Now, let's apply this to an example of a case study, Anastasia. From her assessment findings, we can see coarse crackles in the right upper and middle zones of her lung. Her cough is non-productive and she has been unable to clear her secretions effectively using other secretion clearance techniques such as ACBT. We used the Cough Assist machine with suctioning, which enabled her to expectorate large amounts of thick yellow sputum. Since English is her second language and she only moved to Australia 10 years ago, we thought to provide an interpreter to ensure communication doesn't get lost in translation. This helped to ensure that appropriate consent was given by Anastasia and that she fully understood the treatment that we would be providing to her. Thank you everyone for listening today. I hope this helps you with your future patients on this placement, and I'm looking forward to working with you all during the placement. Have a great day.